Hey everyone. Let's see if Instagram will kick on over there. It says it's streaming, but you never can tell. There it goes. All right. There we go. Got everybody up and running. So, happy Thursday for you. Just a quick note, I'm going to be changing my live days. Next week, I'm going to start doing lives on Mondays. So I'll have a little bit more flexibility throughout the week. And I can use the stuff from the live maybe to find more of us clinical people who want to jump into this digital health world. So, welcome to everyone. And this is Career Coach Rod here. So, if you're just joining, drop me a comment or send me a message and tell me where you're watching from. I am a former bedside nurse, and I've been in digital health for about 25 years at this point. Digital health transformation all around the world. And tonight I want to talk about something that's happening right now in healthcare that most clinical people don't even realize yet. So, this week, 90% of healthcare executives said the entire sector needs to fundamentally change in the next 5 years. But here's what nobody's saying out loud: they can't do it without you. I'm going to share how I accidentally proved my own point when I ended up a patient in the very same emergency department where my team redesigned the workflow. So here we go. A few years ago, I was working with an A&E department in the UK. And for those of you in the US, A&E is not a cable channel. It is accident and emergency. And it had the same problems that emergency departments always do: overcrowding, long waits, frustrated patients. And I brought what I had done at emergency departments in the States, this fast track for people who are there with headaches and belly aches and people who really just want a note to get out of work for that day, that sort of thing. Now, my thinking around that and what I'd seen before, it didn't change any of the regulatory requirements, and it didn't add any resources, but it created a different mindset for how to triage and move patients through the system based on clinical patterns that we all recognize from years at the bedside. And it reduced wait times for certain patient categories by nearly 40%, and the staff could breathe again. Patients weren't sitting for hours with conditions that needed quick intervention. But here's the twist. About a year and a half ago, I fractured my wrist, slipped down some stairs going on to the underground in London, and I was in full denial that I had a fractured wrist, like, most clinical people. Now, guess where I ended up? The same exact accident and emergency department that I had worked on years before. And I walked in finally admitting that I had some sort of problem and I was in pain. And within minutes, I was embedded into the workflow that we had previously done. And poof, I was x-rayed, I was triaged, x-rayed, casted, a little bit of pain meds, and had my follow-up appointment for my real cast, once the swelling went down. And I was back at the car, back in the parking lot, 1 hour and 15 minutes after having walked out of the car. So I was literally a beneficiary of my own sort of clinical thinking that has already scaled across thousands of other patients. That's when it really hit me. This is what clinical leadership in digital health actually means. This is what it looks like. It's not about touching 8 patients during your shift and making sure that they're taken care of. It's about touching 8,000 patients or 80,000 patients with the clinical wisdom that you've built over the years. So I did the math recently, and as a bedside nurse, even if I worked every single possible shift for the entire year, I'd probably see between 2,000 and 3,000 patients annually. So that's the ceiling. So no matter how skilled I became, that was the ceiling. But an AI early warning system that we built at one of my previous clients, we implemented that, and poof, 847 emergency department visits disappeared in a single month. That's more patients protected than I probably would have seen in about half a year of bedside shifts. And the thing is, I'm not special. Every single one of you has clinical insights right now that can be scaled like this. we're not talking about highfalutin clinical stuff. You know why certain patients deteriorate before others see it. You know which workflows create safety risks. You understand what actually works at 2 a.m. when everyone's exhausted. And right now, healthcare is moving faster than it ever has. Just this month, new data shows healthcare is deploying AI at 2.2 times the rate of other industries. We're up to 71% of hospitals now have predictive AI in their medical records. That's up from last year. So here's what a lot of clinical people think when they hear the words digital health. They think that they're going to lose their clinical skills. They think that the technology is going to replace doctors and nurses, but the opposite is true. Technology needs clinical brains to make it actually work. Let me prove it to you. Every time a hospital implements a new electronic health record system or an AI system without clinical leadership involved, the same thing happens. The system makes great sense on paper and in the boardroom, but fails catastrophically in reality. Clinical people, they find workarounds, patient safety suffers, the technology gets blamed. In New Zealand, they've just appointed Dr. Dale Bramley as CEO of Health New Zealand. That's their entire national health system, 5 million people. Why do they pick a physician? Because when you're rolling out digital health initiatives across a whole country, you need somebody who thinks like a clinician first. This is what I call the clinical credibility factor. You have a protection instinct that non-clinical people don't have. When you see a workflow, you immediately think, what could go wrong? How could this affect my patient at 2 a.m.? What happens when the system goes down? So here's the thing. Right now, healthcare executives are desperate for this thinking. Harvard Medical School just launched a program called Leading AI Innovation in Healthcare. That's because they know the technology is easy. The clinical side, that's the hard part. Most clinical people who transition to digital health start by thinking, I can help more patients through technology. And that's true. But what nobody tells you is that if you move on into leadership roles, your impact then multiplies again. So I spent years as a digital health nurse traveling all over the States doing that sort of thing and making a great impact. But when I stepped into leadership roles where I was making decisions about strategy, which projects to fund, how to prioritize initiatives, that's when things really changed. As a nurse implementing a system, I could influence how well it worked at one hospital, maybe in, mostly in one department. But as a leader, helping set the direction, my decisions then exploded, and I could affect entire healthcare networks at a time, sometimes millions of patients over decades. And here's what nobody else talks about. These leadership roles pay accordingly. In London right now, there's an advertisement for an Epic nurse. That's the title of the job, Epic nurse, paying £100,000. That's like 5 or 6 times the normal pay for a nurse here in the UK. And they're not paying for somebody to follow instructions. They're paying for somebody with clinical judgment who can prevent the £1,000,000 mistakes. Here's why I'm being so direct tonight. CMS in the United States, Centers for Medicare and Medicare and Medicaid Systems, the ones that pay the bills so often in the U.S., they just mandated that payers must implement a new AI-powered prior authorization system by January 1st, 2027, 14 months away. An AI mandate just rolled out. It just came. Multiple states now are passing laws requiring clinical oversight of AI in healthcare. If you remember back the electronic records, everything had to be printed at the end of the day, back when things were started. Georgia's just said healthcare decisions can't be made by AI without clinical review. That's probably in response to the federal law that says, yes, they can. So we'll see how that comes out, right? Virginia, California, Illinois, they're all doing it. This is the exact same pattern that we saw with electronic health records. Remember when electronic health records became mandatory through the HITECH Act? The clinical professionals who understood both healthcare and technology before the deadline had their pick of roles. You could swing a dead cat and get 3 jobs. The ones who waited found themselves playing catch-up. I'm watching the same thing happen right now with AI. Early adopters, clinical professionals who understand that this is coming and position themselves now. They're capturing these six-figure roles, the chief nursing informatics positions, the consulting gigs paying 200 and 300 an hour. And before you think, I don't have the technical skills, well, neither did I. I just decided it should be done. I decided I wanted to do it. The technical stuff is learnable. It's all easier than blood gas analysis. Your clinical judgment, that took years to develop. And nobody's learning it in a boot camp. They're not getting it fast. They have to get it from you. So let me make this really practical. Clinical professionals are moving into roles like clinical informatics officers, digital health product managers, healthcare AI safety officers, and implementation directors. These aren't leaving healthcare. These are healthcare roles. Australia's Digital Health Agency has both a chief clinical advisor for medicine and a chief clinical advisor for nursing. There's two. Why two? Because they know that the clinical perspective and leadership isn't optional. And when you're building systems that affect millions of people, you need both. This is all about the digital stuff in Australia, and they got to have at least two chiefs. And here's what gets me excited about this. When I helped implement that accident and emergency fast track system, it's still running years later, and I happen to be one of the people who benefited from it, unfortunately, because I needed the assistance. The digital health systems that you help create, they are improving lives for patients long after you've moved on. Your clinical insights become permanent contributions. So I know some of you are thinking, but I love patient care, and I get it. I kept my nursing license active for 10 years in my digital health career, the first 10 years. I kept it, just in case. But eventually I realized I'm not abandoning patient care. I'm just caring for thousands of patients at once instead of several at a time. So here's let's take a look at the opportunity. The healthcare transformation is happening with or without you. The question is, do clinical professionals like you shape it, or do tech people who've never worked a shift shape it? If you've been feeling frustrated in your role, if you have ideas about how systems could work better, if you wake up thinking there has to be a better way, that's not dissatisfaction with healthcare. That's recognition that your clinical expertise is meant for something bigger. I write about this every week on my website, rodgamble.com, breaking down digital health career opportunities, sharing industry insights, and showing clinical professionals how to position themselves for these roles. So head over there after this live and explore what's possible. You can get in touch with me there as well. And drop me a comment if this resonates with you. Tell me what your clinical problem is that you'd like to fix. If you could scale your expertise beyond your current job, beyond the bedside. The patients who need your clinical judgment aren't just the ones in front of you. They're populations, they're whole populations who will benefit from systems designed by somebody who truly understands healthcare. So thanks for being here tonight. And remember, your clinical credibility is your competitive advantage. Don't waste it on systems that limit your impact. Don't waste it and think that you can't do anything else, that you're just a nurse, just a doctor, just a therapist. You're not. You're required. All right. Thanks, everyone, for showing up. And I'll have little snippets of this posted throughout next week. Thanks. Bye for now.